Did you know starts now, but first, bong docking time. Welcome all to Did You Know, episode 12. And on this one, always we're going with the Health Canada health warnings, but this time it's Britain. Let's get started. Cannabis health warnings in Britain. Oh boy. I wonder if it's like us. Let's get started. Cannabis health warnings in Britain. Illegal for recreational use and is classified as a Class B drug. Doctors can prescribe cannabis since medical cannabis was legalized in 2018. The NHS versus private clinics. While cannabis-based medicines have been legalized, prescribable in Britain since 2018, NHS prescriptions are extremely rare and limited to a handful of conditions like severe epilepsy and multiple sclerosis. The vast majority of patients access their prescriptions through private clinics. Wow, isn't that something, eh? I'm thinking the NHS is the National Health Service, but you got to go through private clinics. Wow. Current health warnings and guidelines. Mental health risks. The BMJ Mental Health and King's College London researchers found that individuals who self-medicate with high THC cannabis, 10 and above, to treat baseline anxiety or depression actually experience higher rates of paranoia and dependency than recreational users. Wow. I agree with that. Furthermore, recent findings highlight that high-potency cannabis can worsen mental health conditions, exacerbate suicidal ideations, and increase the likelihood of developing psychosis. Well, I've always said it before. If you're not under supervision and you're doing basically self-medication and not understanding that it doesn't work for everything, it has specific uses, there's going to be issues. Current health warnings and guidelines. Psychosis link. Prominent UK psychiatrists caution that individuals who use strong cannabis regularly increase the risk of developing psychosis by up to 9 times. Clinic safeguards. Following tragic cases involving vulnerable psychiatric patients, medical experts are calling for tighter regulations, mandatory NHS mental health consultations, and face-to-face assessments rather than relying solely on video consultations for private cannabis prescriptions. There is another one. This has got to do with, for some reason, if a video consultation happens, the patient will not follow the regime, will not follow the prescription, is what it sounds like. But if it's face to face, I'm going to see right through you to see if you're lying to me. I don't know. But if you think that helps, and I hope you have the numbers to prove it, the more face to face you have that want to follow your lead to take low THC cannabis when they know that's not what's working for them, I don't know how you're going to win. Current health warnings and guidelines. Evidence-based. The Medical Cannabis Clinicians Society advises that while prescribed medical cannabis generally features lower THC levels than illicit street cannabis, there still is a lack of conclusive clinical evidence that it is an effective treatment for depression and generalized anxiety. Okay? Because if you were prescribed cannabis for, as we say, treatment of depression and generalized anxiety, and you're self-medicating, no wonder there's paranoia and psychosis and all these other things they're talking about in Britain. Sad. Recap on cannabis health warnings in Britain. It's illegal for recreational use. Oh, everybody wants to be medical now. Prescribed medical cannabis generally features lower THC. I do not know how that can work. But they found a way. And last but not least, clinic safeguards are now going to include face-to-face assessments. Because some patients didn't stick with the regime. But if there's a face-to-face, they will. I'm not sure. But that'll do it for this episode. As always, be one with your cannabis medicine. Unlock the healing powers. We'll see you on the next one. Peace. And Weed Shop Winnie says, see you on the next one. Peace!